are talking about the Norma Verticalis, and it is made up of 3 bones. This is the frontal bone, this is the parietal bone, and this is the squamous part. Squamous part of the occipital bone is also included in the Norma Verticalis. We have 3 types of suture. That is, this is the coronal suture. This is the sagittal suture, and these are the lambdoid suture. Yeah? And this is the place where the coronal suture meet with the sagittal suture is the bregma, and it is the site of the interior fontanelle, and it disappears with the age of 18 to 12 months. And here we have the lambda, and it is the site of the posterior fontanelle, and it disappears with the age of 2 to 3 months. And then we have over here we have a sagittal suture, and in place between 2 sagittal sutures we have the parietal foramen, and the line between the sagittal suture between the 2 parietal foramen become more or less vertical, and the point between these 2 parietal foramen is basically oblivion, and it is the site of the 3rd generated eye. And basically the missionary vein passes through the parietal foramen, and it basically connects the veins of scalp to the superior sagittal sinus. And then we have the temporal lines, and basically it's the part of the Norma Verticalis, but we can also include in the Norma Verticalis because some part also lie over here. And this is zygomatic arch, and the frontal process of the zygomatic arch, basically from here the temporal lines start, and when it meets the coronal suture it divides into 2, that is superior temporal line, the inferior temporal line, and the superior temporal line basically fade posteriorly, where the inferior temporal line arches downward and forward and again meet downward. And then we have the vertex, this is the highest point, and then we have this all the vault, and yes.